But first tonight, John Pollock is a family doctor, and for almost 30 years he's worked hard at keeping people alive and well. He hasn't always succeeded. Over the years, many of his patients have died of cancer, and John's been alongside them as they've lost the battle. Now he's on the other side. John Pollock has terminal cancer, and he is pleading for the right to get help to die. Assisted suicide. Hannah Ockleford with the story.
I have spoken to dozens and dozens and dozens of doctors about euthanasia in my practicing lifetime. Very few of them are against euthanasia. Quite a number of them have actually performed euthanasia.
He's been a GP for 30 years. In your practice, have you had patients talk to you about euthanasia?
Yes.
And what sort of advice or help did you give them?
Well, euthanasia is against the law.
Would you be happy to advise a patient how to kill themselves?
That's a little marginal. I'm better not to answer that question directly.
But now the dilemma's deeply personal. Dr. John Pollock is terminally ill.
In many ways, it's worse for the family than it is for the person dying. The person dying, when he's gone, is totally without any sort of suffering whatsoever. I mean, he just doesn't exist. But the family is left with those last images, which will last a long time. And I suppose I'm very aware of that. And I don't want that.
What he does want is the right to decide when he's had enough. At 61 years old, John was living life, work, travel, family and fun. And then a shock diagnosis.
It's ironic that I've always been a campaigner against smoking and the dangers of that. And here am I likely to die largely of lung cancer.
John's years in general practice means he knows all too well what lies ahead, some of which for him is simply intolerable.
If I had something like a stroke which wiped out my ability to communicate and left me possibly being aware but unable to talk to my family or my friends, that's time to go, no question.
John wants the ability to determine when he dies, the choice of voluntary euthanasia, a choice his family wish he had too.
Just seems logical, really. Why make the pain worse, you know? It's awful that he's got cancer. Why would we want to make him suffer more than he needs to?
The idea that a mercy that you are legally obliged to show an animal is somehow not, you're not allowed to have that for people. It just seems ridiculous.
I'm a little ashamed that I've left it so late before I've actually come out and said, look, this law needs to be changed. It's cruel, it's poorly thought out, and I have absolutely no doubt at all that here in New Zealand it will change.
While it's legal in some countries, here it's not.
The New Zealand Medical Association is not against individuals having the choice. But what we're against is then involving the doctor in assisting the outcome of that choice. In this case, assisting suicide.
Of course, suicide is an option for John, as it is for anyone.
To kill myself, I have got to do it at a time when I am physically and mentally capable of doing it. So I've got to do it probably a lot earlier than I would otherwise choose to have it done if I could be assisted. I have to do it alone. I can't have my family with me because my family could be accused of assisting me.
We certainly don't want to prolong an individual's suffering, but it's very difficult with all the science around today to be absolutely sure that there is no hope.
John's realistic. Voluntary euthanasia won't be here in time for him, But there is some comfort in simply speaking out.
We have to change this law. It is cruel, it's poorly thought of, and it needs to change.
I personally know that if I had to, I would help Dad end it. But he can't ask me to do that, and I can't do that.
He would never ask.
He would never ask, obviously.
Dad's death is inevitable, but misery and suffering doesn't have to be.
What I want is for my family to remember me as I was, and that my death be relatively quick, so that they don't have to spend weeks, months watching a scene which will be remembered by them for years and years.
John Pollock there talking to Hannah Ockleford.